So it just made me think about like what does the health of communities look like? They differ a lot in that pharmacies play a pivotal role in community health. And I think a lot of times they get left out of the conversation. Um, Pharmacists aren't like real doctors, as people try to say, but they're doing a lot of community health education. And there needs to be more Black pharmacists. I was one of the only Black people working in my pharmacies. So I would say like if you're out there and you want to be a pharmacist, like go for it because we need you. The community needs you. So please, please, please do it.
Hey friends, welcome to Public Health Careers. I'm Meharry Richards, founder of the Public Health Millennial and host of Public Health Careers. Join us as we dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies to help you learn, navigate, and transform your public health journey. On today's episode, we have Kyra Robinson. Kyra is a strategist for the Women's Health Initiatives at the Missouri Foundation for Health. Kyra is a passionate public health professional focused on addressing health disparities, empowering underserved populations, and fostering collaboration among stakeholders to create systemic change. She conferred a Bachelor of Science in Biochemistry and Molecular Biology at Fisk University and a Master of Science of Public Health at Meharry Medical College. In today's episode, you'll hear and learn more about why community involvement is essential in public health, the crucial role doulas play in advocating for birthing individuals, the importance of embracing pivots in your career path, how harm reduction is a vital approach in public health, why we need to engage with people with lived experiences to enrich community initiatives, and much, much more. Be sure to hit that subscribe button, share this episode with someone, and enjoy.
Hi, this is Kyra Robinson. I am a public health strategist, and you're listening to Public Health Careers.
Kyra, welcome to the show. Super excited to hear more about your experiences.
Thank you.
Yeah, my pleasure. Looking forward to hearing about how you got to where you got to and the journey to getting there.
Of course.
So before we jump into any of that, how do you identify and tell us a little about your personal background?
Of course. I identify with she, her pronouns. I am a proud Midwesterner. I am from St. Louis to be exact. I am a Leo, a doula. I am a self-proclaimed Beyonce of my family, meaning I'm the firstborn grandchild, niece, and everything in between. And I take my role very seriously. I like to think of myself as a leader and a nurturer. And outside public health, I love connecting with community and exploring opportunities for personal growth.
And what does personal growth look like for you right now?
Right now, personal growth, I'm really big on reading. I'm really big on listening to podcasts. Public Health Careers is one that I listen to. So I'm very happy to be here. Yeah, so that's me.
Awesome. Well, I will leave some book recommendations maybe to the end, or if there are books that you are reading that you would recommend to listeners, I will get a list from you afterwards. And thank you
Yes,
so much for listening to the podcast. That means a lot.
yes,
And I appreciate you sharing your background as well.
of course.
Awesome. And then jumping more into your work before getting into your career. So your work focuses on combating reproductive health inequities for Black birthing populations. Can you share the challenges and successes you've encountered in this mission?
Yes, of course. So some successes that I have encountered, doula reimbursement was passed in 2024. As a doula, that's really important for me because it's how I get paid. So reimbursement through Medicaid went into effect October 2024 in Missouri. Um, Basically enhancing essential care for Black birthing populations specifically, because that's who I like to focus on. But mainly are people in rural areas as well. Another success is the increased awareness is happening in Missouri. I'm seeing a lot more doulas and midwives and people wanting to get into the birth worker space. Um, I'm really liking the momentum that Missouri has right now. A lot of people are talking about Black maternal health, which I love. And it doesn't just stop with OBs. It begins within community here. And I would love to give a shout out to Jama Birth Village, where I got my doula certification at. They are a pillar in this community within St. Louis, and I just want to give that out to them.
And what inspired you to get that certification?
So I thought I was going to be an OBGYN when I first started in my career. Um, I got into my master's in 2020, so the start of the COVID-19 pandemic. And as I went through that, I realized maybe medicine isn't for me. I really connected with community on a deeper level. Um, and I felt kind of as an outsider when it came to medicine. I preferred being in a community, and I knew as a doctor I wouldn't always have those opportunities. So moving into public health just seemed like the natural sway of things for me.
Love that, and I'm guessing now we'll hear more about that trajectory and your thought process and that as we get more into your story. But I think
Yeah,
that's very important,
yeah,
and for like in well, firstly, shout out to Medicaid for being able to give payments for something that probably didn't have as easily accessible ways to pay people that are doing this important work, as well as I think you also shared that birthing happens before the OBGYN. It happens in community. And that's why it's so important to have community, have doulas, have this birthing ecosystem that really supports people, particularly Black birthing people. So maybe one other question around this is, what is the importance that you've seen in doulas or having supportive systems and communities around birthing people?
yes, of course. Doulas and support systems, I hate to say it like this, keep people from dying. They act as advocates. Giving birth is very hard. Even leading up to giving birth is hard. Pregnancy is hard. Um, and sometimes mamas and birthing people, they don't know how to advocate for themselves. They just know what they're feeling. So as a doula and as a support system, I'm there to like say the things that they don't want to say. And it's really important. And sometimes, especially as Black people, we don't know how to interact with the healthcare system. So having someone there that kind of knows the lay of the land and can communicate for you is really important. And that's what I found that my clients really love is that I don't have to interact with the doctor if I don't want to because you're there. And I know that whatever I say to you is going to be relayed in the way that I want it to be. Um, so, yeah.
So what I'm hearing is like finding a trusted person that can be the advocate, that can be like that middle person in those conversations and really like share maybe the challenges or the I don't know, I'm looking for the word, the hesitations maybe in
Yeah.
having those conversations. So maybe what is some of the top things that you are communicating with healthcare providers or coaching clients with around this?
Yes. Some of the things that I am saying to healthcare professionals is really getting them to look into home life. Um, yes, we're here to deliver a baby, but what happens when we go home? Postpartum depression is a really big thing, especially in the Black community. We don't talk about mental health. Um, so that's something that I really try to prioritize when I'm talking to healthcare professionals and I'm talking to clients. Yes, we have a baby, but I don't want to lose you. What are we going to do once you have this baby? How are you feeling? What's your mental health right now? Um, and sexual education is something that I really hone in on with clients. A lot of people don't know a lot of things. So I make sure that I just create a space that's inviting and open so that we can ask any questions. Like I'm seeing your private parts. So we should have some type of rapport. I spend a lot of times with my clients getting to know them personally, which I feel like sometimes doctors don't get to do because they're very in and out. They have to bill, we need you out of here by a certain time. But as a doula and as a birth worker, I'm able to create that relationship. So yes, repeating myself. um, Sexual education, talking about mental health, and making sure I build a rapport or something that are three things I really focus on.
Yeah, those are essential. I'd imagine, like especially that relationship part and having someone that you can trust and communicate with. Because as you say, you see in the private parts, you're having these conversations and conversations in a time when someone can be very vulnerable and going through a lot of things and their body and hormones and all these different things are happening. So like having that support system can be a big game changer in the outcomes and the support that someone does feel throughout that process.
Yes, of course.
So what systemic changes do you believe are essential to achieving equitable maternal and reproductive health outcomes?
I have a few. Free universal health care. I feel like everyone can agree on that. Eliminating that financial barrier that people have, especially when it comes to birthing babies. It's a 70K bill, and no one I know can afford that. In that same vein, having expanded access and having awareness on healthcare options. So meaning we need more clinics, we need more OBs, we need more OBs that look like us. Um, we need to have more conversations about fertility. What is IVF? What does that look like for you? What is abortion? What type of abortions? There needs to be more expansive healthcare options and awareness on them. Um, Another thing, I love talking about sexual education, but we need to rethink curricula when it comes to schools. Um, we need to be talking about the things that we don't want to talk about, STIs, and the community involvement in that. Parents need to be talking to their kids. It doesn't just happen at school. Um, Another thing, policy development. We need to have policies that advocate for reproductive health. We need to have communities at the table talking about these policies. Um, and last thing is holistic reproductive health care. Um, so instead of just thinking about STIs, abortion, and pregnancy, we need to be thinking about the whole reproductive life cycle. So, including males, what goes on with males within reproductive health, but also our aging population gets left out a lot. Um, Menopause is a thing, and it kind of falls by the wayside, which I really hate. Um, I would love for us as a society to move into a reproductive justice framework to address social determinants of health and mobilizing our communities for systemic change and really thinking about the intersectionality between reproductive health and us living our daily lives.
Love that and I appreciate that. And there's a lot of great information in there that I definitely think people that are interested in this reproductive justice and maternal health can really see where they can fit themselves into that. Because in all those things you say in there are ways that you can get involved with your public health background and really find solutions and create system changes that are so important. And as you said, like universal basic healthcare, universal healthcare is something that we talk about so much, and I think it just allows so much equity to that is not already in the system. It creates more of that equity and creates a space. And I've been hearing this a lot more in the reproductive health conversations, is like men's health and how men's health plays into the woman or the birthing person's health and the baby's health. And I think
Yes.
that's something that I haven't heard before, but I think it's something that's important to have this conversation, that it's not just the person that's carrying baby, but the
Mhm.
other partner also plays a part in it. And how do we create, and I think like that's the thing in public health, is like how do we create a family structure that's strong and healthy that can
Yes.
create just healthy outcomes.
Yes. 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 Plus one to everything.
Love it, love it. Okay, so shifting a little bit here. Before we get into more of your collegiate journey and how you got to where you got to, would love to hear, what does public health mean to you?
Uh, I love public health. Um, Public health is all about the well being of community. I love community. It is about protecting and improving the health of those we live, work, and play with. As a public health professional, I don't think of myself as being adjacent to community, but I'm truly within community. I work in my community. I live in my community. Um, every time I step out the house, I think about my community. And I think when it comes to public health, it's more than just, oh, you got sick. It's more than just numbers. It's that community aspect. It's knowing your community, it's being within it, it's working with community members. And that's what public health means to me.
Love that. And how did you come to the perspective of I'm embedded in my community? I love community. Community is so important to the work that I want to do.
I've always been a community person. I come from a background of doctors and teachers. So my grandmother was really a big pivotal point in my life of being within community. She was a principal who worked at a school that served teenage mothers. And so I've always been kind of in a birth worker mindset and frame. Growing up, I spent a lot of time at that school doing like random things that she wanted me to do, um, doing a lot of community service. So when I found out what public health was, I was like, I've already been doing all this. Passing out sexual health pamphlets, yeah, I do that. I've been doing that since I was 5. Just talking about what it means to be healthy. My mom does that every day. So public health to me and community was just something that came naturally to me. Um, and I feel like that because I was entrenched in community at a very young age, everything that has followed has always just been about community for me. Um, so yeah.
I appreciate that perspective. And I'm glad that you do have that perspective in doing this work because I think that it is very essential.
Yeah, it is.
So you got your Bachelor's of Science in Biochemistry and Molecular Biology at Fisk University. Walk us through that thought process.
Of course. So Fisk University is HBCU. I knew I wanted to go to a HBCU. Both my parents went to HBCUs and my grandparents. Um, but I landed on Fisk because of its connection to Meharry Medical College. So like I said before, I wanted to be a doctor. Um, at the time, I wanted to be a pediatrician. Wasn't really thinking about OB at the time. And so when I got there, I was a chemistry major and I thought I was following in the footsteps of my mom. She was a chemistry major, is now a family physician. The chemistry and the math and me weren't mathing. So I needed to find another major that was still within, that could get me to medical school, but had less math, and biochemistry and molecular biology was that. So that's how I got there.
No, that's real, and I think that's probably one of the chemistry is probably one of the biggest things that switches people from like medical school path into public health, from what I've heard. So, but that lines up and makes a lot of sense. And were there any formative experiences that you had during undergrad that you wanted to share?
Yes. I was a big data to knowledge scholar. So basically, I used bioinformatics, so biology and computer science, to look at data. And that was the first time that I ever did anything like that. I don't really know how to use my iPhone, so learning how to code was definitely a curve. I was on a learning curve with that, um, but it was fun looking at data in a different way, especially when it comes to computer science, because I wasn't a computer science person. So that was something that was really transformative, and also doing research. I was doing wet lab research on antibiotic proteins, antibiotic resistant proteins. And it got me, I think that's the first time I ever really thought about public health. Why are people going to the hospital and getting sick? And why do they have proteins in their body that are antibiotic resistant? that shouldn't be a thing. What are we doing wrong as a society to have that happen? Um, and that was the first time I realized, like, oh, maybe everything isn't about medicine. What are the social implications of things, and why do these things happen? Yeah.
Yeah, love that, and I think that that is also a thought process that many of us do have in, because I feel like it's just exposure to not knowing that there are other ways to think of health until we like sit down and like, oh, like this is happening. Why is it that at a societal level that this is happening, and realizing that there are these bigger things at play that aren't necessarily linked to our diseases, or linked to the health outcomes that we see in a hospital setting. And as we know, social determinants of health, a majority of your health is outside of a healthcare setting. So when you realize that, it really does delve into, okay, how can I make that impact? And many times it is leading about public health. And to that point, when did you learn about public health, or when did that like term come up for you, if at all, at this point in time?
Yes. So at that point, I didn't really hear public health until March 13th, 2020. I was a senior in college, and they told us we were going home. And I was like, okay, we're going home, cool. But why are we going home? There is a virus going around. Okay, well, why? And that's when I started hearing about public health. And it started making me think, like, I don't want to go to medical school. I kind of want to do what these people are doing. I want to be Dr. Fauci. I want to be on CNN talking about viruses. Um, so that's when I first heard it. And I was like, oh, this is kind of cool. I'm going to apply and get my master's in public health.
Well, that's very timely, very, very timely.
Yes.
And before we get to the masters, were there any undergrad takeaways that you had that you wanted to share?
Yes. I feel like this is my takeaway from everything I always do, but be able to embrace your pivots. Pursue learning opportunities that excite you, and challenge yourself to do things that you wouldn't normally do. I never thought I would be coding, but I did. Um, so yeah, please just do whatever, you guys. You don't have to have a plan. Sometimes the plan doesn't work.
Yeah, the plan unfolds itself as you keep walking, so definitely keep walking.
Yeah.
So after your undergrad, you got a master's of science in public health at Meharry Medical College. What was that thought process? You shared you were a senior, pandemic happened. How did that go into, okay, I'm applying to go into this program?
Um, it happened very fast. It was very much a whirlwind being a senior and having no type of plan afterwards. I wasn't applying to jobs. I took the MCAT. I started applications for medical school, and then I was like, I don't want to do this anymore. Um, and I spoke to my mom, who I mentioned before. She's a family physician, and I told her about public health, and she was just so excited. And she is the one that really pushed me into it. Because at first I was like, "Oh, mom, it's a pandemic. Why would I go to school during a pandemic?" And she was like, "No, this is the perfect time. You're at home. You need to do it." And she's like, "If you go back and you get your medical degree, you're gonna be like a force to be reckoned with, because you're gonna know the community side, and you're gonna know medicine, and you're just gonna be like really big." I was just like, "Okay, mom, I'm gonna do it." So I only applied to three programs. So I applied to Meharry Medical College, Baylor, and Morehouse, and I chose Meharry because of the relationship it has with Fisk. And it was in Nashville, a place that I already knew. So I was like, this place is perfect for me. So I just decided to stay in Nashville.
That's awesome, and that makes sense. And shout out to your mom for pushing you. I think
Yeah.
sometimes we do need that, and I also appreciate that perspective, because that's also the perspective that I had when I went into my master's program. It's like you're going in, you can get this public health degree, and if you do end up going to medical school, you're just going to have this added knowledge, this community base in really taking forward the work. And if you don't, then you still have this degree, which is very impactful. You can do a lot of different work with. And
Yeah.
as we've laid today, you decided that maybe the doctoral path wasn't for you, which was also the case for myself. So when you were in your master's program, you were an intern at the Metro Public Health Department of Nashville and Davidson County. Tell us about that experience.
Yes, it was such a transformative experience. I worked on the Nashville Strong Babies initiative. Um, and that initiative was focused on high zip code areas that are experiencing maternal and infant mortality. And my job was to connect patients with doctors at Meharry Medical College and to follow them throughout their first year postpartum. So really the focus was connecting families to resources. So one of the things we used to do that I loved and thought it was genius, we would have open clinics and uh, we would just rent out a YMCA like meeting room and we would ask our participants to come, bring baby, bring siblings, bring dad, bring whoever. So it's really a family affair, and we would give baby like a quick checkup, check in on mom, and we will always have diapers and um, uh, other like baby things to give away, mom bags. We would have a nutritionist there to go through like what should baby be eating, what should mom and family be eating. It was I really loved the familial component about it, even though it was about babies and reducing maternal and infant mortality. Um, we always focused on the family unit, which I thought was really important, and I had not experienced before prior to working within the internship.
And was that intentional for you to go into an internship where you were doing work around maternal and infant health, or was that something just kind of happened by happenstance?
I would say both. I knew by that time I knew I wanted to be an OB. Um, but one of my public health foundations teacher was a pediatrician, and she was the lead doctor of the program. And I kind of just like talked to her, and she's like, "You should come. You should come hang out and come intern here." I was like, "Okay, cool." And I kind of just like weaseled myself into it. I really wasn't thinking like, "Oh, I want to get into maternal health." I kind of just fell upon it.
Yeah, happens to the best of us.
Yeah.
And while you're in your master's, I believe you're also a pharmacy technician. So tell us about that experience and how that informed your work.
Yes. So I worked as a pharmacy technician in St. Louis and in Nashville. And one of the things that really stood out to me was the prescriptions and the health disparities that I saw between the two communities. So when I was working in St. Louis, I was working in a predominantly Black area, and a lot of our patients there were of the aging population. A lot of them had diabetes, high blood pressure. So we were filling a lot of those prescriptions compared to Nashville when I was in a college town. The only CVS within like a 10 to 15-mile radius from downtown. Um, and I was filling psychiatric meds there because of the college town. So a lot of Adderall medications, depression, anxiety, birth control, STIs. So it just made me think about like what does the health of communities look like? They differ a lot, and that pharmacies play a pivotal role in community health. And I think a lot of times they get left out of the conversation. Um, Pharmacists aren't like real doctors, as people try to say, um, but they're doing a lot of community health education. And there needs to be more Black pharmacists. Um, I was one of the only Black people working in my pharmacies. Um, so I would say, like, if you're out there and you wanna be a pharmacist, like, go for it, because we need you. The community needs you. So please, please, please do it.
Yeah, and I appreciate that perspective as well. It's like, and I don't think I've heard that too often, but it makes a lot of sense. It's like, you're working in a certain community where there's certain demographics of people, and within that, they're going to have certain diseases or certain medications or prescriptions that they are going to get, and that begs a deeper question that kind of like, I guess it's more of like a public health question that you're asking yourself, like, why is it that this community needs these things, or like, why is it that these are the diseases or the infirmities that are happening to the certain communities at that point in time, which I think is a cool takeaway. And also wanted to kind of figure out how did you work in St. Louis, Nashville, master's program, intern? How do you balance all of that?
Oh my goodness, and I worked at Starbucks for a little point in time as well. I'm a busybody. Don't be like me. I love to be busy. And I love to be within community. So why was I working all those jobs? I have no idea. I just wanted to fill my time. I think I was coming off from the pandemic of being stuck and having cabin fever. So it's like any chance I can get to get out the house and talk to people, I'm willing to do it. And if I can learn and do it at the same time, I'm gonna do it. So pharmacy technician, I kind of just fell into that as well. I was like, what can I do that's still health related, but I can talk to people and learn more. So pharmacy technician was just like an easy thing to fall into. So if you are looking to go into medical school or you want to be a public health professional, pharmacy technician is a very easy job. Please apply, and we need a lot. And please be nice to your pharmacy technicians and your pharmacists. When you go to the pharmacy, they are overworked and underpaid.
That's very real, and there's always a need for pharmacy techs, and I think that is maybe like not an easy way, but a way that is there for people to work a job and kind of like also get this kind of experience while going to school, if that's the path that you want, or build that experience before you go to school, and all of that. So that's awesome, and yeah, I also second that as well.
Yes.
And were there any takeaways from your master's program that you wanted to share with us?
Takeaway. Be busy, but don't be too busy. Still have fun. Find balance. I would say, I don't think a lot of people say this, but I found my master's to be a lot easier than my undergraduate degree. I think because of the focus area, I was only focusing on one thing, not 20. Um, so be very intentional with your time. Um, and if you're going to get a master's, do it in something that you actually find interesting and that you love.
Yeah, I echo that as well. I also felt my master's program was quote unquote easier that my bachelor's program, and I think maybe coming from the perspective of you did a biochemistry and molecular biology undergrad degree, and I did a biology undergrad degree, it could be very rigorous in a lot of the work. Like the thing that I think was very different from undergrad to master's program is just writing.
Yes.
A lot of like writing and reading a lot more reports as well as presentations were some of the big things that kind of shifted, but all the other things I think were not as technically hard.
hmm And I will say, as a biochemistry and molecular biology major, I did write, but I was writing like what is reports.
Hmm.
And in your master's, you're writing a lot about social and programs. So it's a different type of writing. So you have to pivot. So again, bringing up pivot, be able to pivot and be okay with pivoting.
Yeah, absolutely different kind of writing. I remember my internship preceptor used to say that they really need to teach us how to write better, and I think that that probably is still the case right now. But it is a different type of writing, but I think very valuable when you're able to garner those like different skill sets of knowing how to communicate, how to share information, how to analyze research, and all of these different things.
Yes, yes, of course.
So you graduated and you became a health equity fellow at Planned Parenthood of the St. Louis region and Southwest Missouri. How did you come across this and what do you do in that role?
Of course. I came across it on LinkedIn. I knew I wanted to work at Planned Parenthood. I didn't know what I wanted to do, but I was like, I want to be in reproductive health, doing something. I knew I wasn't quite ready to go into the job force. I was moving back from Nashville to St. Louis. So I needed like a buffer job, and I found this. And um, while I was there, I was working as an intern for the Missouri Momnibus Coalition. So if you know about the Omnibus bill nationally, um, doula reimbursement is one of the things on there. But basically supporting Black maternal health and advocating for that through policy. So Missouri has its own coalition, and I was helping build that coalition to become what it is today. So a lot of things that I did was facilitation. I did a lot of cold calling, talking with the community to get people to join the coalition, setting up the parameters and the policies of the coalition. What are we doing? Why are we doing it? So it I felt like that job gave me a stepping stone back into St. Louis, because I was away for so long. It was very hard for me to infiltrate the community again. I kind of felt like an outsider, especially because before I left St. Louis, I was not doing any maternal work. So I didn't know any of these folks. So I had to build those relationships. And Planned Parenthood was a great way for me to do that. And a lot of the people that I met through Planned Parenthood, I still work with today in my current role. Um, so I love Planned Parenthood. If you go to Planned Parenthood, shout out to y'all. Please donate to Planned Parenthoods across the nation, because they're really helpful to the community.
Absolutely. I will find a link for donations for Planned Parenthood and put it in the show notes for anyone that is interested in doing that as well. But I love that perspective of, okay, I want to do reproductive health work. Let me find an organization that kind of resonates with that. I want to get back into the St. Louis like area and like build my network and connections. And in doing so, in getting this for Planned Parenthood, it has allowed you to grow in that space. And like to your point, you still have some of those relationships today, which I think is so important. But just kind of having that direction of, okay, let me find where I can fit myself in this reproductive health space in St. Louis. So question here is, you graduated, this is like your first role after your master's program. How difficult was that transition for you to like lead this coalition and build that out, and what were some of those challenges for you?
I, hmm, I needed to figure out how to facilitate. I had never facilitated anything ever before. Of course, I had help from a partner organization and Planned Parenthood, of course. Um, but being the person to like cold call people and like sit in a meeting and like conduct a meeting was something that I had never really done before. Um, so I think being at Planned Parenthood really sharpened those skills. It made me like pushed me to get out of my comfort zone, which I really loved doing. Um, and I guess another challenge outside of myself um, was just finding people who had the time. And I feel like that's still one of the problems that a lot of organizations have. A lot of people are doing double jobs, and A lot of people who were in the coalition also had full-time jobs. So it's like, okay, how do we balance this, or how can we pay somebody to be within this role? And I feel like that's a challenge throughout a lot of things across the nation, but especially in St. Louis, finding funding mechanisms.
Yeah, to that second point, that's very real, and especially when we think about wanting to do health equity work, or like having a health equity lens in our public health work, which means that you're going to have community-based people in these conversations. And to that point, many of them have other jobs, other responsibilities, and it really is difficult for people to give up their time, especially people that have been marginalized by systems, to give up their time to show up in space. So really thinking about that, I think that's an important concept for all of public health and all of us trying to like really get community led work, and which I think is like so essential to really get into the root of the issues, because the answers are in the communities that have been marginalized, for the solutions to those marginalized or oppressed situations.
Yes.
And the first point that you made around the facilitation, I think that is huge as well. That and that's a big part of like a lot of public health work. And I think like thinking back on my experience, my master's program was one of the times that really got me out of my bubble and allowed me to build that skill and get more comfortable and be able to like do this kind of thing where I'm having conversations with people on public platforms and being comfortable with it. But I think like the advice I would say there is like people in public health, like facilitation is a skill that you can use in so many domains of public health. And if you are able to really build and find ways to do that within your master's or bachelor's program, it's going to go a long way in just making you feel comfortable in being able to do it, because it is important. And there are many, many coalitions, and a lot of work in public health, in health, is around coalition building. So
Yes,
appreciate
yes,
you sharing that.
yes, yes.
And then after your role at Planned Parenthood, you became an overdose prevention coordinator at the University of Missouri, St. Louis. Tell us about that shift and what you did there.
Yes, another pivot. Look at me, the queen of pivots. I pivoted again, and I knew I wanted to go into an academic space, because I knew I needed healthcare. So I was like, I need insurance. I need to pivot. So I pivoted into harm reduction, which I was not familiar with before I became an overdose prevention coordinator. But once I got there, I loved it. So harm reduction, for those who don't know, is about reducing harm. Specifically, historically it comes from drug use. So reducing harm when it comes to using drugs. So giving out needles, giving out Narcan, um, and things like that. Um, and as I was in this role and I learned more about harm reduction, I was like, wait, I've been doing harm reduction my whole life. Everything is harm reduction around me. Wearing a seatbelt, taking birth control, wearing a mask. Hello, guys. Is harm reduction. And I fell in love with looking at public health from a harm reductionist lens. And I kind of call myself a harm reductionist now, now that I even like left that role. Um, so yes, I love harm reduction. I loved working at UMSL. Such a great informative experience for me as a public health professional.
And I want to talk more about that pivot for a second, because you're saying, okay, you're in this maternal health space, you build the skill sets, and then you're like, okay, I love this work that I'm doing. I also need to get like health insurance and like get the things that grown adults typically would like to have like a I don't know, a solid base and foundation to live a healthy life, which I think is very important and probably we don't talk about enough in public health cases. But I'm not going to go there. The shift is more okay. So you're shifting into overdose prevention. How did you maybe like rationalize that in your head as your next step, or how did you like think about, okay, yes, this is something that I want to do, and then in doing that you were able to like build this more bigger appreciation for harm reduction, and kind of looking back on your life and seeing that this is something that you've already been kind of implementing and already kind of been doing, but now you're getting like maybe like a broader perspective on that?
Yeah. So my pivot into harm reduction, I knew I wanted to do something with grants. So my position was grant funded. I knew I wanted to write grants, and I wanted to learn more about the grant making process. Um, and so working at the university, we were actually an intermediary. So we got funds from the Department of Mental Health. It got funneled through us, and we funneled it out to community, which I don't think a lot of people work within that space and would necessarily call that public health. I feel like a lot of my positions so far have not been the typical public health career. And as an overdose prevention coordinator, I remember in my interview, I was talking about being a pharmacy technician, and I told them, I was like, yeah, I lie. I lie, and I do whatever I need to do to make sure community is good. And that was one of the things that they were like, we need you here. That's a harm reductionist. And I didn't even view myself as a harm reductionist. I was just like, I just love community. And if someone can't afford something, we're going to figure out how they can afford it. Um, and so it was more not just the overdose prevention stuff, because I was like, it's important. St. Louis has a high rate of overdoses, Missouri, the state, too. But I was more thinking about that grant piece. How do people get funding? What do grants look like? And how can I write grants for my community? So that was kind of my thought process behind that.
Yeah, I love that, and I'm glad that you're able to share that, because that's maybe a perspective that someone might need to hear. Because I think maybe too often we get stuck in a bubble of what we're doing, but not realizing that the skill set and the knowledge that we have can be applied in many different ways, as well as there's so much that we can continue to learn. To your point, like you wanted to do grant writing and really understand how that plays into the role, and the will of public health, which I think is awesome, and kudos for you for being able to do that pivot and successfully do that work.
Yes, 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 yes. Thank you.
And you were or are, I can't remember, you're a board member at Living in Victory Sober Living. How do you come across that? What was the impact and importance, and what did you learn from being a board member?
Yes, I still am a board member. I'm actually the marketing and outreach chair. Just got that role. But I got introduced to Living in Victory through my work as an overdose prevention coordinator. So I was working on two grants while I was there. One, the state opioid response grant, and the other center, which was about centering Black men who use drugs. We started that grant after a mass casualty um, that happened in St. Louis, a mass casual overdose that happened. And we realized, like, hey, no one is supporting our black brothers, so we need to make a grant to do that. And that was a grant that used a community advisory board of people with lived experience, which was super cool. That was something I had never done before. Um, and through that, I met the CEO of Living in Victory, and she was looking for board members, and she came to me and asked me, and I was just like, cool, yeah, I'll do it. I'm so down to be a partner in crime. And um, through that, I have met so many other people with lived experience, and met so many people through recovery and who are currently using and need harm reduction. Through that, it made me want to start hosting healing spaces. So with two of my coworkers from UMSL, we decided to create healing spaces and healing circles for Black men and women affected by substance use. So we host them once a month. We always have food and harm reduction supplies. And the conversation never centers around their drug use. It is always about community and it's about personal growth. So our first one we ever did was about self-care and what does that look like and how do you forgive yourself for any transgressions you've done or anything you feel like you need to forgive yourself for and loving on yourself. And it's been an amazing experience, I will say, just listening to people's stories and them saying like no one ever just sits and listens to us. And it's like, I'm so glad I can be the person to sit there and have you like be like a pseudo therapist for you in a sense of just like sitting here and having a meal with you and treating you like a human being. So that I don't even remember the question anymore, but um, I think that just speaks to like my love for community and just going back to like even though I wasn't doing maternal health work, um, still thinking about community outside of that. So yeah, it's really a special experience. Everyone should do something with people with lived experience of any sort.
Yeah, and I appreciate the fact that you're also doing this work and just being someone that sees the value in someone being a person and a human. And I think too often we other people and we create these narratives in our head, but we just don't see people for like who they are, what they are, who they want to be. And I think that that is so important, especially in this work, to be seen. And I think that that's one of the first steps in like just being comfortable in a space. So shout out to you and thank you for doing that work. And want to ask one other question here. So you said that you started off as a board member because you were part of this community advisory group that did grant making, was introduced to the executive director who asked you to become the board member and become a board member. And you shared that you are now a board member that's overseeing the marketing of the work. So like how did that progression happen for you?
It happened very quickly. uh, I became a board member in August of 23, and I've helped to get the board off the ground. We're still figuring things out as we go. Um, and they needed a marketing and outreach chair, and stepped up and said, I'll be it. I love talking to people. I can definitely market whatever you need me to market. We have not started yet on our new marketing campaign for 2025. Um, but I feel like a lot of the things I do are based off what people ask me to do. Like I said before, I'm very busy. I'm a busybody. Don't be like me, unless you want to be like me. Um, and I kind of just like said yes. I know people are in the season of saying no, but sometimes when people need it, I just say yeah, and you just get the work done because you know it needs to be done. Um, so yeah,
Yeah, and I appreciate you sharing that. I feel like there's so many ways for us to make impact outside of like maybe our traditional 9 to 5 job, and really finding those spaces where we can use our skill sets to help move forward work that's important to us. I think is really a good thing to do. So once again, kudos for you, and I hope that you all are able to. I guess hit all your goals, get to the achievements that you'll hope for 2025.
yes, yes,
And in your current role, you're a strategist for the Women's Health Initiatives at the Missouri Foundation for Health. So, what do you do?
yes. I am a grant maker. So I support grant making efforts to advance health equity across Missouri, with a focus on Black maternal health and community centered approaches. One thing we look for as funders, grant makers, is systems change, people who are doing the work within the community and changing the systems. So I shouted out Jamal Birth Village earlier. I'm going to shout out Generate Health, one of our grantees. I'm going to shout out Uzazi Village, who's doing this great maternal health work in Kansas City, Missouri. So yeah, I do a lot of project management, ensuring resources are distributed effectively and equitably. I collaborate with my other strategists because the women's health initiatives are just one of the many initiatives we have at the foundation. So right now we're focusing on how can we all work together more effectively. So we have initiatives like food justice. Food justice and maternal health are very similar, especially when it comes to breastfeeding. Um, I facilitate learning and improvement in healthcare needs by convening health professionals and community members. I build relationships with grassroots orgs, which is probably the main part of my job. Building relationships and maintaining authenticity and trust when you're within community is really important with working in this role, especially when you're a funder. A lot of people look at you as like money bags. You're going to give us money. But you need to build the relationship first before you can just give out money. um, you need to be able to trust each other. So that's something that is really important to me.
Absolutely, and as someone who also works in a funder role in my 9 to 5 role, I definitely appreciate a lot of that, and I think like even the conversation around how you like actively listening and creating a space like earlier in your journey, actively listening, creating a space for people to share and be honest, I think is a big part of the role, especially when you're trying to work with grassroots organizations that are people that are on the ground, and building those relationships and trusting relationships is so important. How did you get interested in this role, and then how did you market yourself to get this role?
Yes. So when I was at UMSL, one of my grants that I worked on was actually granted to me by my current job. So when I knew I wanted to step out of this role and get back into maternal health, I basically stopped my job link website, and I found this role just randomly. And I was like, oh my goodness, this sounds like perfect for me. I already got into maternal health. I know the landscape. I know the folks. So why can I not just be a funder and fund people I know who need the money and who are doing the work? So the way I walked in and marketed myself was as a doula. I walked in as a doula first and as a community member first. Um, and I feel like that's what's made me very valuable at the foundation, because I have personal connections to this work. And I'm in this work all the time, even outside of the 9 to 5. That made them think like, oh, Kyra can open up us to a whole nother subset of a community that we have not really been able to tap into. So I really appreciate being a doula. I get all the doula questions, and people are constantly, asking me about doula stuff, and um, it's just really exciting being a doula and a community member and a funder.
I appreciate you sharing that. What do you enjoy most about your role, and what's most difficult?
What I enjoy most is interacting with community and going to community events and learning about what people are doing and what organizations are doing um, with the limited amount of funds that they have, um, which is like truly amazing to me. And I was like, I know as a doula, like I use a lot of my own money for my business, but like you're like running a whole business on this budget. Like, whoa. So it just really amazes me the ingenuity that my community has and how passionate they are. I really love that. The challenges, I can't give money to everybody. I would love to fund everybody. I would love to just throw money out. That's just not how the government works. That's not how things work. So sometimes people go without. And I would just love to say, like, any other funders out there, if you're interested in funding maternal health, do it, please. Honestly, if you're interested in funding anything, and if you can, do it. There's a lot of cool people doing cool work that need the money, and money makes the world go round. So please fund them. Please, 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 please.
Yeah, it truly is amazing when you do look at many of these grassroots organizations and you like look at their budgets and then look at the impact that they're able to have in community, and you're like, wow, they are doing amazing work. If they just had just this little bit more money, the amount of impacts that they would be able to have
Yes.
could just be like, I don't want to say impactful, but impactful in so many ways. So
Yes.
definitely appreciate that. And one last question on this: what are the things that you all look for in grantee partners? What are the things that are important to you all as you all are having like conversations and thinking about funding priorities?
Yes. Well, systems change is definitely something that we look for. Uh, and a lot of people are like, what is systems change? And it's like anything that you are doing to disrupt the system. So the example I love to give is like, there's no water, but you are creating a water filtration system in your backyard and you give out water to your community. That's a system change. You're disrupting it. You're making something out of nothing. And we look for like fun and innovative ideas, things that people aren't doing, but you're doing it. You might be the only person that is doing it in your area. Um, we really look towards rural communities. They are people that don't have a lot of resources a lot of the times. Um, so, what are you guys doing down there to help you figure out whatever needs that your community needs? The other thing we look for, um, it's just someone within community. We want someone with lived experience. We want the like Juma Okushonla from Juma. She is a midwife and a doula. Someone who taught me how to be a doula. Um, she went to Ghana and learned indigenous birthing practices. And like that's a person that I just look up to and would love funding, because she's within community and she has been a teen mom. She's had kids. She's birthed babies. She's been to Ghana. She's seen the babies. She does everything. Um, so we just look for those champions, those community champions. So you might be that person. I don't know. You have to look us up and put in an application.
Absolutely. Well, I appreciate you sharing that. And then opening this question up to like your broader career and life. What are you most proud of in your professional or personal life?
I am most proud of my healing spaces, because that's something that I don't think a lot of people do. And it kind of just came out of a need, or not, it wasn't a need that anybody told me or told us. No one came up to us and was like, we would love to have dinner and you to sit and talk to us. But it was something that we were just like, we would love to talk to people with lived experience more, but we have to bring them here and give them something. So just even like thinking about that and like how does that work? How do we ask these questions? What if someone gets too emotional? We need to have someone on standby. How do we get them here? Where should we host these? We host them in community. We host them in the places that they already go. Do they need transportation? We figure out transportation. Um, and now that I'm a funder, it's like, wow, like, how are we funding this? How can we get funding for this? So it's like I kind of made my own little program without making, like, without any backing. which is something I'm like really proud of. Just like three young Black women just like doing stuff because we want to do it and we saw the need. So I would love to continue to keep doing things like that.
Oh, I love that. And I'm glad that you were able to cultivate your skills and create this space. And I hope that that continues and you're able to just continue to have that impact within your community.
Yes, yes.
Yeah, so thank you for that.
Thank you.
And then moving on to the Furious Five, the 5 questions that I ask all guests.
Okay.
So, number 1, what advice would you give to a student trying to pursue a career in public health?
I would say explore your interests. Public health is so broad, and I don't think I realized that until I got into it. So identify what excites you, um, whether it's data, community work, or something else. Um, find it. And be okay to embrace your pivots as part of your journey. Sometimes your plan is not your plan. Sometimes people got other plans for you, and that is okay. So be okay with the pivots. Be okay with when things don't work out the way you truly want them to.
Number 2, if you're talking to someone wanting to get into your position, what advice would you give them?
Oh, yes. Be open to diverse experiences and be a passionate learner. Learn from the institutions and the people around you. And I'm not just talking about your teachers and your professors and your family. Like somebody on the street might give you a world full of knowledge. And communicating with people is really important. Be an open communicator. Always be willing to go places and pitch yourself and talk. Because you never know who will pick up on what you say and where that will take you. Your name is sometimes in rooms that you don't even know about. So be okay with that. Be okay with just being yourself and going into things authentically.
Number 3, what's something you're working on improving in your life right now?
Yes, I am working on branding myself as a healer and really getting my doula business off the ground, and being a better public health professional. I always want to learn. I always want to go into my work authentically, and opening myself to other communities that I have not tapped into yet.
And number 4, professionally, do you recommend anything?
Ooh, yes. I recommend Black Women Radicals. It is an advocacy organization that focuses on uplifting Black women and gender expansive folks. One of the things that I love about this org is that they have a school of Black feminism and they do teach-ins. So each month they do a teach-in on a different thing. Recently there was one about Black lesbianhood, which was very interesting. So if you would like to learn about Black feminism and get into that community, Black Women Radicals is the way to go. So please look them up and donate. They're looking for donations.
And then number 5, if there was one piece of advice you'd give to your younger self, what would it be?
It's okay not to have a plan. Um, I'm a loose planner. Now that I've grown out of like being very type A, focus on knowing and feeling confident in yourself and your skills, and everything else will follow. Like, just be you, and you got it.
Love it. And then I'm adding in this new section of the show, a past guest question.
Mhm.
And since I didn't have a past guest that asked this question, I asked one of my friends in public health for a question. And this is the question she gave me that I will be asking you.
Okay.
So, what would you say is your favorite or most valuable public health initiative, and what was the impact it had?
My favorite. Mm. My overdose prevention work. It was something that I didn't know about before I got into it, but I feel like I learned so much in that span of working as an overdose prevention coordinator. And it made me really realize how public health has harmed community and how I need to show up authentically and gain trust before I do anything else. Um, so overseeing that grant and working with people within community um, was something that I hadn't really done before. I did it as at Planned Parenthood and at the health department in Nashville, but working with people who use drugs or used to use drugs is a community I've never touched. Um, so it made me think about how I show up as a person and how I want to show up as a public health practitioner. And I feel like the skills that I've gained from being an overdose prevention coordinator are going to follow me throughout my entire career. So that was a basis. So I will say anybody who wants to get into public health and wants to get into a diverse population, people who use drugs is one. um, Such great people. Yeah. So yeah, be diverse in your experiences, please, 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 please.
Well, I love that. And Kyra, thanks so much for coming on the show and sharing your experiences. It has been a lot of fun to learn more about your journey and the work that you're doing. And I'm hoping and wishing you the best for this year and the future.
Yes, of course. You too.
Yeah, thank you so much.
Thank
So,
you.
my pleasure, my pleasure. Housekeeping items, everyone. Thank you all so much for watching. If you have not as yet, be sure to hit that subscribe button, leave a like, leave a review, and share it with a friend who gets some value for it. Greatly, greatly appreciate you all. See you all next week. Peace, everyone.